Freddie, you're gonna get my famous spaghetti and spaghetti sauce. I hope you're hungry. Sophia. Sophia. What's wrong? What's wrong?
I'm feeling tightness in my chest. And my back hurts.
No. This is not happening. Devin! Devin, help!
Dad!
No, let's go.
What's going on?
Go get my car keys, Devin. She's having pain in her chest. Let's take her to the doctor.
No, Dad, stop. Call 911 and get her aspirin. I think it's in her purse. What's going on, Mom? Tell me how you feel.
I feel tightness in my chest.
Here, sit down.
I've got pain in my neck, my back. I feel awful.
Tell me more about how you feel.
There's pain, pressure in my chest. And my shoulders hurt. My shoulders.
Yes, we need an ambulance right away. Okay.
Chew these.
Okay.
Don't worry. Help is on the way.
Thank you.
I'm just glad I knew what to do.
Me too.
Let's go. She's gonna be okay, Dad.
If you weren't here, I wouldn't have known what to do. Thank you. Let's go.
An emergency can happen anytime, anywhere, to anyone. You can be ready.
Giving someone first aid means getting up close and hands-on. You might have to touch their blood or other body fluids, and this comes with a small risk of infection if the person is ill. The good thing is, this risk is very low, and there are easy steps you can take to make it even lower, for you and for the person you are helping. Washing your hands with soap and water is the best way to lower the risk of infection. If time allows, wash your hands before giving care, and always wash your hands after giving care. Wash for at least 20 seconds, making sure to cover all surfaces of both hands with soap, including between your fingers and under your nails. If soap and water aren't available, you can use a hand sanitizer with at least 60% alcohol. Dispense the recommended amount into the palm of one hand. Then, rub it over all surfaces of your hands and fingers until they are dry. This should also take about 20 seconds. Alcohol-based hand sanitizers can help decontaminate your hands, but they may not eliminate all types of pathogens. So, it's best to still wash your hands with soap and water as soon as you can. Using personal protective equipment, or PPE, such as latex-free disposable gloves, CPR breathing barriers, masks, and protective eyewear, is another effective way to lower the risk of infection. Latex-free disposable gloves and sometimes other PPE may be included in first aid and bleeding control kits. If possible, wear latex-free disposable gloves when giving care, especially if there is a chance you will contact blood or other body fluids, when you have a cut or scrape on your own hands, and when you must handle items or surfaces soiled with blood or other body fluids. After giving care, used PPE is considered contaminated and should be disposed of properly or disinfected according to manufacturer guidelines. Here are a few more things to keep in mind when it comes to PPE. First, ideally, you'll wash your hands and put on gloves before giving care. But in a life-threatening emergency, it's not always an option. In this situation, do not delay care until you have washed your hands or found PPE. Your risk of infection is still very low, but delaying care could make the risk of a bad outcome much higher. Instead, wash your hands as soon as possible after giving care. Second, when giving care, even if you have PPE on, it's important to think about cross-contamination. Don't touch your mouth or eyes, and be mindful of how much you touch things around you. Germs can spread that way, and the next person who contacts those surfaces could be at risk. And finally, if you are exposed to blood or another body fluid, contact a healthcare professional for advice on what to do next.
After giving care, remove your gloves properly to avoid contaminating your skin and other surfaces. Here's how to do this. Touching only the outside of the glove, pinch the palm side of one glove near your wrist. Carefully pull the glove towards your fingertips, turning it inside out as you pull it off your hand. Hold the glove in the palm of your other still gloved hand. Next, slip 2 fingers under the wrist of the remaining glove. This time, avoid touching the outside of the glove. Pull the glove towards your fingertips, turning it inside out as you go, with the first glove now contained inside. Dispose of the gloves properly, then wash your hands. In the workplace, follow facility policies for when gloves need to be disposed in a red biohazard waste bag.
An emergency can be stressful, but you can calmly and confidently help a person even if you don't know what's wrong. Just use 3 simple steps to guide your actions. Check, call, care. Before approaching an injured or ill person, first check the scene for safety so you don't end up injured or ill too. At the same time, quickly look for clues as to what happened, how many people are involved, and whether there are other bystanders who can help. If the scene is safe, check the person. Start by forming an initial impression as you approach. Is the person alert and moving, or do they appear unresponsive? Is the person bleeding? Are there any obvious signs of injury or illness? Your next steps depend on what you observe. If the person appears to have a life-threatening condition, call 911 or tell someone to do so and get equipment right away. Then start care according to your training.
My name is Genevieve. Can I help?
I hit my head. I think I need to go to the hospital.
Call 911. Get the AED and first aid kit.
Got it. Hi, yes. There's been a car accident at the school. Yeah, one of the drivers hit his head.
If the person appears unresponsive, first do a quick check to see if they really are unresponsive and whether they are breathing before calling and starting care. If the person's condition is non-life-threatening, or if you're not sure what's wrong, continue to check the person to get more information. This will help you decide whether to call and what care to give.
Shot came a few years ago, but
Okay.
When a person appears unresponsive, it's important to check if they really are unresponsive, and if so, whether they are breathing. This should take at least 5, but no more than 10 seconds. To check for responsiveness, use the shout tap sequence. Shout, using the person's name if you know it, and tap the person's shoulder.
Claudia, are you okay?
For an infant, shout and then tap the bottom of their foot.
Hey, baby, are you okay?
If the person does not respond in any way, such as by moving, opening their eyes, or moaning, they're unresponsive. To check for breathing, make sure the person is face up. Then, quickly look to see if their chest is rising and falling, and listen for normal breath sounds that are quiet, regular, and effortless. Isolated or infrequent gasping sounds are not normal breathing. If the person is unresponsive, not breathing normally, or is responsive but not fully awake, this is a life-threatening emergency. Immediately call 911.
Call 911, get the AED and first aid kit.
Okay.
Then give care based on the condition found.
find out what may be wrong with the person, continue your check. Start with a brief interview, then move to a focused check if needed. Keep in mind, if at any time you think the person may have a life-threatening injury or illness, immediately move to the call step and start care according to your level of training. When interviewing a person, you don't need to ask a lot of questions. You just need to ask about SAM. SAM is an abbreviation that stands for signs and symptoms the person is experiencing, allergies the person has, including past severe reactions, and medications the person is taking or medical conditions they're being treated for. That's it. The answers you get can help you determine what kind of help the person needs. Plus, you might learn something important about their injury or illness that you can share with EMS if the person's condition worsens before EMS arrives and they can no longer talk.
Can you tell me what you were feeling before you fell?
Yeah, I got really dizzy and everything was just dark and my heart was racing.
Does anything hurt?
My knee hurts so bad. Oh my gosh, I hurt my elbow.
Are you allergic to anything
No.
or taking any medications or anything?
Oh, you know what? I am taking blood pressure medicine, but I think you're supposed to eat with it, and I haven't eaten anything all day.
If the person can't speak for themselves for any reason, other people at the scene may also be able to provide useful information. They may have witnessed what happened, or know the person, and be able to answer the SAM questions. The last step, if needed, is to do a focused check. This just means taking a closer look at the person based on what they told you during the SAM interview, how they're acting, and anything you can see that appears to be wrong. For example, if the person tells you their knee hurts, check that knee for any signs of an injury. Or if you see blood coming from their elbow, carefully check that area for an injury that needs attention. Remember, you might need to check more than one body part, depending on the situation. If the person has any pain, stop touching that body part and note what you find. Likewise, note any lack of feeling in a body part. After you finish checking the person, call 911 if needed and begin care. Keep an eye on them in case their condition worsens, and be ready to take additional steps.
Thank you.
To place a person in the recovery position, extend their arm that is closest to you above their head. Then, roll them toward you onto their side so their head rests on their extended arm. Finally, bend both knees to stabilize their body. That's all there is to it. While waiting for EMS to arrive, continue to monitor the person for any changes in their condition and give additional care if needed.
When you picture a heart attack, you might think of someone clutching their chest in intense pain. But the truth is, it doesn't always look or feel like that. Symptoms can vary a lot from person to person. Let's hear more from one of our experts.
I'm Lynn, and I'm a subject matter expert for the American Red Cross. Symptoms of heart attack can vary from person to person. Some people feel mild symptoms, they sometimes describe as indigestion-like, and others feel really severe symptoms, sort of like an elephant sitting on your chest. When I had my heart attack, I felt sort of a punch to my chest with a radiating pain down my left arm, and I thought, oh my gosh, that's sort of classic heart attack. And I was pretty surprised because I was fairly fit and fairly young. So I called for help and got to the emergency department pretty quickly. I didn't feel very normal. I felt, I guess, sort of like I was having palpitations or something, and it just made me feel anxious. So as I was waiting for help to come, I was walking around the house looking for aspirin, because one of the things we tell people with heart attacks is to take some aspirin. And of course, in the house, I had youngish kids, and I didn't have any aspirin. Some people deny their symptoms or try to rationalize that there's something else, because I think basically they're scared. They don't want it to be a heart attack. It's really important to get help as soon as you can, because every minute counts in terms of keeping your heart healthy. So that was my experience. It was pretty classic. Not all people experience it like that. And no matter what your symptoms are, if you even think it might be a cardiac problem, a heart attack, you do want to call for help right away, because every minute matters.
Exactly. Call 911 right away if a person has any of these signs and symptoms. Chest discomfort that may range from mild to unbearable and feel like pressure, squeezing, tightness, heaviness, or burning. Discomfort in the arms, back, shoulder, neck, jaw, or upper abdomen. Shortness of breath, nausea or vomiting, or a clammy appearance. While waiting for EMS to arrive, have the person rest in a comfortable position to reduce their need for oxygen. If they are alert, offer them aspirin unless they have been advised not to take it. This is often found in a well-stocked first aid kit. Give 2 to 4 81 milligram low-dose aspirin tablets or 1 325 milligram regular strength aspirin. Tell the person to chew the tablets, which will speed absorption into the bloodstream. If the person has a prescribed medication for chest pain, such as nitroglycerin, also assist them with this. Monitor the person's condition and be ready to give additional care if needed.
When a person's heart stops beating, they may continue to make noises that can be confused with normal breathing. These are called agonal breaths, and they happen in about 40% of cardiac arrests. They may sound like occasional gasps or snoring. The person's body may twitch or jerk as they have an agonal breath. This is a simulation of agonal breaths. Now, keep in mind, this is just one example. Agonal breaths can look and sound different for each person. Here's how some 911 callers have described them.
His breathing is very slow. He looks like he's snoring.
She's gasping? Like gasping for breaths.
The breathing is weird.
The most important thing to remember, agonal breaths are not normal breathing.
CPR includes giving cycles of 30 chest compressions followed by 2 breaths. Together, these work to keep oxygenated blood moving to the brain and other vital organs of a person in cardiac arrest. 5 key actions make CPR high quality. These can double, or even triple, someone's chance of survival when CPR is started within the first few minutes of cardiac arrest. When giving CPR to an adult, the first action is to compress the chest at a rate of 100 to 120 compressions per minute. Second is to compress to a depth of at least 2 inches. And third is to allow the chest to return to its normal position between each compression so the heart can refill with blood. Think of it like this. Each time you compress the heart, blood is sent out through the body. When you release the heart, it fills again, allowing more blood to be sent out during the next compression. The fourth action is to minimize any interruptions to chest compressions to less than 10 seconds. This includes interruptions when giving breaths or to apply an AED. The fifth is to give breaths that last about 1 second and make the chest begin to rise, while also not being too large. We'll look closer at how to achieve these things shortly. Although CPR begins with chest compressions, there is one exception to this rule. When drowning is thought to be the cause of cardiac arrest, you should give 2 breaths first before starting compressions. This is because there will not be air in the person's lungs. The breaths will provide needed oxygen more quickly.
Before giving chest compressions, make sure the person in cardiac arrest is lying on their back on a firm, flat surface. If they're on a bed or couch, and it's possible to do so, quickly and carefully move them to the ground before you begin. Now, let's look at how to position yourself. Start by kneeling beside the person with your knees near their body, spread about shoulder width apart. Place the heel of one hand in the center of their chest, and place your other hand on top of the first one. Interlace your fingers and make sure they're up off the chest. Align your shoulders directly over your hands and lock your elbows. This allows you to use your body weight to help compress the chest. When giving compressions, push hard and fast. Counting out loud will help you keep a steady rhythm.
1 and 2 and 3 and 4 and 5.
Compress the chest to a depth of at least 2 inches at a rate of 100 to 120 compressions per minute. After each compression, let the chest return to its normal position.
Giving chest compressions in combination with breaths increases the chance of survival for a person in cardiac arrest and minimizes brain injury. In this video, you'll learn how to give breaths using 2 types of CPR breathing barriers. Focusing on just breaths first can help you feel more confident with this crucial skill. Using a breathing barrier can lower your risk of infection when giving breaths. However, because the risk is already very low and the benefits of giving breaths can be high, you should not delay CPR to find a breathing barrier if there is not one immediately available. Let's start with giving breaths using a face shield. A face shield is a flat, thin piece of plastic with a one-way valve that is placed over a person's face. Aside from this step, giving breaths with a face shield is the same as giving breaths with no breathing barrier. Place the face shield over the person's face with a one-way valve over their mouth. Then put one hand on their forehead. Put 2 fingers of your other hand on the bony part of their chin and tilt the head back to a past neutral position. This is called the head tilt chin lift technique. Next, give 2 breaths. Pinch the person's nose shut, take a normal breath, and make a complete seal over their mouth with your mouth. Keep the airway open and blow into their mouth for about 1 second, just enough to make the chest begin to rise. Pause to let the chest fall and the air exit. Then give a second breath. Here's what 2 breaths look like as a smooth sequence. A pocket mask is a transparent, flexible device that is placed over a person's nose and mouth. It also has a one-way valve to blow into when giving breaths. There are different sized pocket masks, so first, make sure the mask is appropriately sized for an adult. Then, if needed, pop it open and add the valve. To use a pocket mask, start by placing the mask at the bridge of the person's nose, then lower it over their nose and mouth, placing the bottom of the mask to the chin. Make sure the mask does not extend past the chin or cover the eyes. To seal the mask, place the webbing between your index finger and thumb on the top of the mask above the valve. Then place your remaining fingers on the side of their face. Place the thumb of your other hand along the base of the mask and place your bent index finger under their chin. Lift their face into the mask and simultaneously open the airway to a past neutral position using the head tilt chin lift technique. This ensures a good seal and an open airway. Take a normal breath in. Make a complete seal over the mask valve with your mouth and give 2 breaths. Each breath should last about 1 second and make the chest begin to rise. As you're giving breaths, keep the airway open and hold the pocket mask in place so air does not leak out of the sides. Here's how it looks all together. person's chest does not rise when you give the first breath, reopen the airway, form a good seal, and give a second breath. If the chest does not rise with the second breath, an object may be blocking the airway. That is, the person may be in cardiac arrest due to choking. You'll learn what to do in this situation as part of the choking lesson. Do not try to give them more than 2 breaths at a time, even if they do not make the chest rise. Instead, resume 30 chest compressions, then try again.
Each CPR cycle consists of 30 chest compressions followed by 2 breaths. Smoothly transition between compressions and breaths to minimize interruptions to compressions to less than 10 seconds. Watch as chest compressions and breaths are put together to perform cycles of CPR.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Continue CPR until you notice an obvious sign of life, such as breathing. Other responders arrive to relieve you. You're too exhausted to continue, or the situation becomes unsafe.
When someone is in cardiac arrest, using an AED as soon as it's available may help restore a normal heartbeat and increase their chance of survival. Fortunately, learning to use an AED is nearly as easy as turning it on and following the prompts provided. The AED may come with both adult and pediatric pads or settings. Always use adult pads or settings on anyone older than 8 years of age or weighing more than 55 pounds or 25 kilograms to ensure the shock delivered is sufficient. Some AEDs turn on as soon as you open the case. For others, you must press a power button. Then, follow the prompts.
Attach pads firmly to person's bare chest as shown.
If needed, remove clothing covering the chest and wipe it dry first. Place one pad on the upper right side of the chest, just below the collarbone. Place the other pad on the lower left side of the chest, a few inches below the armpit. If needed, lift the breast to do so. If you need a reminder of how to place the pads, follow the manufacturer diagrams. Plug the pad connector cable into the AED if necessary, and prepare to let the AED analyze the heart's rhythm.
Plug in connector. Don't touch person. Analyzing.
To ensure an accurate analysis, make sure no one, including you, is touching the person by saying "clear" in a loud, commanding voice.
Clear.
Shock advised. Press flashing shock button.
Again, make sure no one is touching the person before a shock is delivered.
Clear.
Shock delivered. Start CPR.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10.
Keep in mind, the AED will not always advise a shock. If no shock is advised, immediately resume CPR with chest compressions until the AED prompts you to analyze again. If there is a second responder at the scene, you should work together. Teamwork minimizes delays in giving CPR and using an AED, which can increase the person's chances of survival. As the first responder begins CPR, the second responder calls for help and gets the AED. When the second responder returns, they kneel opposite the first responder, placing the AED where they both can reach it.
15, 16,
I have the
17,
AED.
18,
I'll set it up.
19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
The first responder continues CPR until the pads are placed and the AED is ready to analyze.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20.
Clear.
Analyzing.
I'll take over CPR.
Shock advised. Press flashing shock button.
Clear.
After a shock is delivered, or if no shock is advised, the second responder immediately takes over CPR. Responders continue to switch roles like this about every 2 minutes. Whether with 1 or 2 responders, continue CPR and AED use until you notice an obvious sign of life, such as breathing. Other responders arrive to relieve you. You are too exhausted to continue, or the situation becomes unsafe. If you stop CPR for any of these reasons, leave the AED turned on and the pads in place. Continue to follow the AED prompts.
When giving CPR to an infant in cardiac arrest, you'll need to adjust the way you give chest compressions and breaths. This is because of an infant's smaller size as compared to a child or adult. Before giving chest compressions, make sure the infant is lying on their back on a firm, flat surface. This could be a stable tabletop or the ground. You can then use either of the techniques you'll learn next, whichever one allows you to compress the chest most effectively. To use the encircling thumbs technique, kneel or stand to the side of the infant with your hips at a slight angle. Place your thumbs side by side on the center of the infant's chest, just below the nipple line. Use your other fingers to encircle the infant's chest toward the back to give support. Then, using both thumbs at the same time, compress the infant's chest about 1.5 inches deep at a rate of 100 to 120 compressions per minute. Let the chest return to its normal position after each compression. The one-hand technique is the same for an infant as it is for a child. Kneel or stand next to the infant. Place the heel of one hand in the center of the chest, just below the nipple line. Position your body so your shoulder is directly over your hand with your elbow locked. Then compress the chest to a depth of about 1.5 inches at a rate of 100 to 120 compressions per minute. After each compression, let the chest return to its normal position. If using a pocket mask, make sure the mask is appropriately sized for an infant so you can make a good seal. If the pocket mask is one size fits all, you may need to rotate it so the narrow end fits over the infant's chin. For an infant, you will also open the airway to a neutral position using the head tilt chin lift technique. This is a little less than you would open the airway for a child. Tilting the infant's head back too far could block the airway. While keeping the airway open, make a complete seal over the valve with your mouth. If using a face shield or no breathing barrier, cover the infant's mouth and nose with your mouth. Give 2 smooth, effortless breaths that last about 1 second each and make the chest begin to rise. Remember, the amount of air needed for chest rise is less than you would need for a larger person. If the infant's chest does not rise when you give the first breath, reopen the airway, form a good seal, and give a second breath. If the chest does not rise with the second breath, an object may be blocking the airway. That is, the infant may be in cardiac arrest due to choking. You'll learn what to do in this situation in the choking lesson. As for any person, each CPR cycle consists of 30 chest compressions followed by 2 breaths. Here's how full CPR cycles look using the encircling thumbs technique.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Here's how full CPR cycles look using the one-hand technique.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One and 2 and 3 and 4 and 5.
Continue CPR until you notice an obvious sign of life, such as breathing. Other responders arrive to relieve you. You are too exhausted to continue, or the situation becomes unsafe.
Just like with adults, using an AED is a crucial part of care for an infant or a child in cardiac arrest. For the most part, operating an AED is the same regardless of age. However, there are some important differences to keep in mind when using an AED on an infant or a child. Some AEDs come with pediatric AED pads that are smaller in size and that deliver a lower level of shock. Or, there may be a way to select a pediatric setting. For infants and children 8 years of age or younger or weighing 55 pounds or 25 kilograms or less, use pediatric AED pads. If they are not available, adult AED pads are safe to use. For children over 8 years of age or weighing more than 55 pounds, always use adult AED pads, as pediatric pads won't deliver enough shock. To place the AED pads, follow the diagrams. For an infant, always use the front back pad placement. Apply one pad in the middle of the infant's chest, and place the other pad on the infant's back between the shoulder blades. To place AED pads on a child, position the pads as you would for an adult. Place one pad on the upper right side of the chest, just below the collarbone. Place the other pad on the lower left side of the chest, a few inches below the armpit. If the AED pads might touch due to the child's chest size, use the front back pad placement. AED pads will not work effectively if they touch.
You may first notice a person is choking by their facial expressions and body language. Seeing a person suddenly reach for their neck is a common sign of trouble. The person may also look suddenly panicked, confused, or surprised. They may start coughing or making high-pitched squeaking noises. The person may also look as if they are trying to make noise, but not be able to cough, speak, or cry at all. As their body is deprived of oxygen, the person may become pale or bluish. If you notice any of these signs, it's time to act. First, confirm the person is choking and ask if it's okay for you to help.
Are you choking?
If the person can speak, cry, or cough forcefully, it means their airway is only partially blocked. In this case, they are still getting air and their body is trying to clear the obstruction. Encourage them to keep coughing until their airway is clear, but be ready to act if their condition worsens. Don't leave them alone.
Okay, keep coughing. Keep coughing.
If the person cannot speak, cry, or cough, or is making only high-pitched noises, this is a life-threatening emergency. Their airway is severely blocked, and the person will soon become unresponsive unless it is cleared. Tell a bystander to call 911 and get an AED and first aid kit while you start care to clear the airway.
Ron, call 911. Get the AED and the first aid.
Got it.
If you are alone with the person, this is a care first situation. If you have a phone on you, call 911 and put the phone on speaker mode while you immediately start care. However, if you do not have a phone, don't leave the person to find one. Start care right away.
Once you have verified the person needs help clearing an object they are choking on, take quick action by telling someone to call for help while you start care. Care consists of giving 5 back blows, followed by 5 abdominal thrusts to force the object out of the airway. To give back blows, position yourself to the side and slightly behind the choking person. Place one arm diagonally across their chest, then bend them slightly forward at the waist. This position helps with clearing the object while allowing you to support the person and brace yourself if they become unresponsive. Using the heel of your other hand, give 5 firm strikes between the shoulder blades. Be sure to make each back blow a distinct attempt to dislodge the object. If they're unable to speak, cry, or cough after back blows, you'll give abdominal thrusts next. Move behind the person and place your front foot between their feet. Bend your knees slightly for balance and stability. Find the navel with one hand. Place the fist of the other hand thumb side down right above your fingers. Cover your fist with your first hand. Then pull inward and upward to give 5 abdominal thrusts.
3, 4, 5.
Be sure to make each thrust a distinct attempt to dislodge the object. Here's how caring for a responsive, choking person looks when put all together.
1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3.
Continue giving sets of 5 back blows and 5 abdominal thrusts until the person can speak, cry, or cough, or they become unresponsive. For a small child, you may need to modify the way you give back blows and abdominal thrusts by kneeling behind them rather than standing. Watch how this looks.
1, 2, 3, 4, 5. 1, 2, 3, 4, 5.
If a person is too large for you to reach around, or they're in a wheelchair, you may need to give chest thrusts in place of abdominal thrusts. You should always use chest thrusts for a pregnant person. To give chest thrusts, position yourself behind them as you would for abdominal thrusts. Make a fist with one hand and place the thumb side of your fist on the center of the chest. Cover your fist with the other hand and pull straight back to give 5 distinct inward thrusts to the chest.
1, 2, 3. 4, 5.
For someone shorter or in a wheelchair, you may need to kneel. Back blows, abdominal thrusts, and chest thrusts are all equally effective for responsive choking, but it may take more than one technique to clear the airway.
If a choking person becomes unresponsive, it's time to start CPR. But for a choking person, you'll add one extra step to the cycle. To start, carefully lower the person to a firm, flat surface and give 30 chest compressions.
9 and 10 and 11 and 12 and 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Compressions may help dislodge the object, so before starting breaths, you'll do the extra step. Open the person's mouth to look for the object, and if you see it, remove it with a finger sweep. Do not do a finger sweep if you do not see the object, because you might lodge it further back in the airway. Complete the cycle by attempting 2 breaths. If the chest rises, the airway is clear. Continue with normal CPR. If it does not rise, keep doing CPR and checking the mouth between compressions and breaths.
9 and 10 and 11.
Care for a responsive choking infant with a severely blocked airway consists of repeating 5 back blows followed by 5 chest thrusts to clear the airway. To give back blows, start by positioning the infant. Place your forearm along the infant's back, cradling the back of their head with your hand. Then place your other forearm along the infant's front, supporting their jaw with your thumb and fingers. Make sure your fingers are not covering their mouth. Turn the infant to a face-down position, holding them along your forearm and using your thigh for support. Keep the infant's head lower than their body. Now, use the heel of your hand to strike the infant between the shoulder blades. Keep your fingers up to avoid hitting their head and neck. Give 5 firm back blows, with each one distinct from the others.
1, 2, 3,
4, 5.
If the infant is unable to cough or cry after back blows, you'll give chest thrusts next. Position the infant between your forearms, supporting their head and neck, and turn them face up. Lower the infant onto your thigh with their head lower than their chest. Place 2 fingers in the center of the infant's chest, just below the nipple line, and give 5 distinct chest thrusts about 1.5 inches deep.
1, 2, 3, 4, 5.
When giving chest thrusts, let the chest return to its normal position between each one while keeping your fingers in contact with the chest. Remember to support the infant's head, neck, and back as you do these steps. Here is how caring for a responsive choking infant looks when it's all put together.
1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5.
Continue giving sets of 5 back blows and 5 chest thrusts until the infant can cry or cough or the infant becomes unresponsive.
1, 2, 3.
If a choking infant becomes unresponsive, start CPR using the infant techniques you've learned. Again, you will need to add one extra step as part of this care. To start, move the infant to a firm, flat surface and give 30 chest compressions.
5, 6, and 7, and 8, and 9, and 10, and 11, and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
After compressions, check the infant's mouth for the object. And if you see it, try to remove the object with a finger sweep. Do not do a finger sweep if you do not see the object. Complete the cycle by attempting 2 breaths. Remember, if the chest rises, the airway is clear. Continue with normal CPR.
1, and 2, and 3, and 4, and 5.
If it does not rise, keep doing CPR and checking the mouth between compressions and breaths.
10, 16, 17, 18.
When a person is ill and needs help, use check, call, care. If at any time during this check you think the person is having a life-threatening emergency, you should call 911 right away or tell someone to do so and get equipment.
Are you okay? My name's Natalie. How can I help you? You have a tree nut allergy?
Hazelnut.
Raina, call 911, get the first aid kit and the AED. Okay.
If you're not sure how serious the illness is, it's better to call for help early than to wait for symptoms to progress. Care should be given according to the condition found and your level of training. That said, whatever is causing a person's sudden illness, some general care steps should be taken. First, you can help the person rest in a comfortable position. Many people find sitting up and leaning forward makes it easier to breathe. It can also help to loosen tight clothing. Of course, if the person is unresponsive and breathing normally, or responsive but not fully awake, you should put them in the recovery position while waiting for EMS to arrive. In addition, keep the person from getting too cold or hot and offer them reassurance to help keep them calm. If the person has medication for the illness, you may also assist them with taking it. For example, you can offer to get the medication for the person or assemble a medication delivery device. Always explain what you are going to do and confirm that you are giving the person the right medication before they or a person's family member self-administers it. Keep in mind, while it's okay to assist with medication, you should not actually administer the medication for a person unless it is allowable by state laws and regulations and you are trained and authorized to do so. Training on medication administration is available through the American Red Cross if you need it. After taking these steps, continue to watch for changes in the person's condition. Be ready to give additional care if needed.
Sometimes a sudden illness isn't totally out of the blue. It might be because of a chronic condition like asthma, anaphylaxis, diabetes, or sickle cell disease. A person with asthma might breathe fine most of the time, but during an asthma attack, their airways narrow, kind of like trying to breathe through a straw. If they don't get help quickly, it can turn into a life-threatening emergency. From the outside, you may notice a person is wheezing, coughing, or gasping for air. They may have trouble talking without stopping for a breath every few words and complain of chest tightness. On their own, these are reasons to call 911. However, if the person has an asthma action plan for when to use medication and when it's time to call, you can help them follow it. Most often, care for an asthma attack includes using a prescribed quick relief medication such as albuterol. To assist a person with this medication, follow the general guidelines you learned. If the person uses a quick relief inhaler, specific actions you can take may include shaking the inhaler, removing the mouthpiece cover, and attaching a spacer to it before giving the inhaler to the person to self-administer as prescribed. Use of quick relief medication can be repeated after 10 to 15 minutes if needed. If breathing does not improve, or if the person becomes unresponsive, call 911. A person can be allergic to almost anything. Mostly it's just an irritating fact of life. But when a person has a life-threatening allergic reaction known as anaphylaxis, things can get far worse. A person experiencing anaphylaxis might have just mild symptoms at first, but things can get serious fast. Within seconds or minutes of being exposed to the allergen, the person may develop more severe symptoms such as hives, swelling of the face, neck, tongue, or lips, trouble breathing, fainting or lightheadedness, vomiting, or signs and symptoms of shock. It's always important to call 911 if someone is experiencing anaphylaxis or has had a severe reaction to the same allergen before. But if certain things are true, anaphylaxis becomes a care-first situation. Here's when that applies. If you are alone, do not have a phone, and the person has epinephrine, immediately help them with using it before trying to find a way to call. After they use the epinephrine, call 911, even if the person seems better, because anaphylaxis can reoccur. Epinephrine can be prescribed as an auto-injector or nasal spray. To assist the person with an auto-injector, remove the cap or safety device before giving it to the person to self-administer into their outer thigh. You can also help by holding their leg firmly to limit movement and by reminding the person to massage the injection site for 10 seconds after a dose is delivered.
Alright, spend 10 seconds, you can stop rubbing.
To assist with nasal spray, remove any packaging and encourage the person to use it in their nostril as directed by their healthcare professional. Note the time the first dose is taken. If the person is still having symptoms after 5 minutes and EMS has not arrived, assist them with the second dose. Diabetes is a condition that makes it hard for the body to process glucose, or sugar. For someone living with it, staying healthy can be a balancing act. If blood glucose is too high, or too low, it can lead to a life-threatening diabetic emergency. In either instance, symptoms can be similar. The person may feel hungry or thirsty, appear drowsy or confused, or feel dizzy, weak, or faint. In a severe case, seizures or unresponsiveness may occur. If a diabetic emergency is suspected and the person is able, have them quickly check their blood glucose level. You can then assist them with taking sugar or insulin as they've been directed. If the person can't check their blood glucose, it's best to give them sugar. If their sugar is low, it can be life-saving. And if it turns out to be high, a little extra sugar won't cause serious harm. The recommended amount of sugar to give is 20 grams for an adult or 15 grams for a child. This can come from many sources, including glucose tablets, liquid or gel, 7 ounces of orange juice, 14 ounces of milk, or candy with fructose or sucrose. Check the label for guidance, but that's about 20 to 25 Skittles, 2 strips of fruit rolls, or 10 to 20 jelly beans. If a child is unwilling to swallow, making a slurry of granulated sugar and water and placing it under the child's tongue may help. Call 911 if the person can't swallow, does not improve within 10 minutes of having sugar, or their condition worsens. Sickle cell disease is a genetic condition that causes red blood cells to become misshapen. During a sickle cell crisis, these cells clump together and block a person's blood vessels. This can cause severe pain. If blockages affect the lungs, it can also lead to acute chest syndrome, a life-threatening complication. Pain from a sickle cell crisis starts suddenly, often in the arms, legs, hands, feet, stomach, chest, or back. The presence of additional symptoms, including trouble breathing, coughing, wheezing, or fever with chest pain, may be a sign of acute chest syndrome. If this happens, call 911 right away. While waiting for EMS to arrive, follow the general care guidelines, including assisting with any prescribed medication. Encourage the person to drink fluids. It can also help to apply a heating pad on painful areas.
Seizures happen when abnormal electrical activity in the brain causes temporary involuntary physical changes. They can have many causes, including a chronic seizure disorder like epilepsy or an injury or illness that affects the brain. A seizure may be startling to observe. When a person is having a seizure, they might suddenly start shaking or have jerky, uncontrolled movements, either in one part of the body or all over. They may also have vocalizations, stare, or lose consciousness. You may not need to call 911 for a seizure if the person has a seizure disorder and their healthcare professional has advised them on when it's okay not to call. But you should call 911 if the person is injured, unresponsive, or is having a seizure for the first time. You should also call 911 if they are pregnant, they're younger than 6 months old, the seizure lasts more than 5 minutes, the seizure happens in water, they have multiple seizures in a row, or they do not start to recover within 5 to 10 minutes. During the seizure, resist the urge to try to stop what is happening. Instead, let the seizure run its course. You can help keep the person safe by moving nearby objects that could cause injury. If it's possible to do so without hurting the person or yourself, you can place them on their side. Once the seizure ends, check the person for responsiveness and breathing, and give additional care if needed. Stay with them until they recover or EMS arrives if they were called. Febrile seizures are a specific kind of seizure caused by a sudden fever in a young child or infant. During a febrile seizure, they may roll their eyes, shake, have arm and leg stiffness, or appear unresponsive. If a child or infant has a febrile seizure, call 911 unless the healthcare professional has advised when it's okay not to call. Care is the same as for any seizure.
Opioids are drugs prescribed to reduce pain. Their effectiveness has led to their widespread use, but also misuse due to their addictive quality. Illegal forms of the drug add to the problem. Of course, not all opioid overdoses happen because of purposeful misuse. Accidental poisonings also occur in people of all ages. When you're checking the scene, you might notice signs that someone is having an opioid overdose. Maybe there's a pill bottle nearby or other drug-related items that catch your eye. These can be important clues. The person may show symptoms such as slow or irregular breathing, sometimes only a few breaths per minute, unresponsiveness, and bluish or grayish skin. Cardiac arrest can also occur.
Brandon.
Always call 911 for a suspected opioid overdose and tell a bystander to get an AED and naloxone. Naloxone, also known as Narcan, can be given via nasal spray to temporarily reverse the symptoms of overdose. It is widely available and can be administered by anyone. The care you give while waiting for EMS depends on the person's condition. If the person is breathing slowly or irregularly, is not fully awake, or is confused, administer naloxone.
I think my brother's overdosed. She's doing it now.
Brandon.
She's breathing.
Brandon, can you hear me, honey? Okay.
However, if they are unresponsive and not breathing normally, immediately start CPR and use an AED. Administer naloxone as soon as it is available without delaying CPR and AED use. After giving naloxone, continue to monitor the person's condition. If they still have symptoms of an overdose 2 to 3 minutes later, give a second dose using a new nasal spray device.
Shock and stroke are both emergencies that need quick action. The most important thing you can do is call 911 right away, then help keep the person safe and comfortable until EMS arrives. Shock is a progressive, life-threatening condition caused by poor circulation. It can develop quickly after any serious injury or illness, including trauma, blood loss, severe burns, or a serious infection. When we say to monitor a person's condition until EMS arrives, this always includes watching for signs of shock. A person experiencing shock may have cool, clammy skin, a rapid heart rate, rapid breathing, nausea, vomiting, and changes in level of consciousness, including confusion, agitation, or unresponsiveness. Shock cannot be managed by first aid alone, so it's important to call 911 and get help to the scene as quickly as possible. While waiting for EMS to arrive, give care for any other injury or illness the person has as possible, and follow the general care guidelines you have been taught. Have the person lie on their back with their feet raised 6 to 12 inches if they can tolerate it. If they might vomit, put them in the recovery position instead. A stroke is when blood flow to part of the brain is interrupted. This can cause immediate effects, including loss of function and trouble thinking. It can also lead to permanent damage. But with quick action, damage can sometimes be stopped or reversed. Although most common in older adults, a person of any age, including a child, can have a stroke. The letters in FAST are an easy way to remember common signs of stroke for an adult and what to do. F is for face. Is there weakness or drooping on one side of the face? A is for arm. Does one arm drift downward or appear to be weak? S is for speech. Does the person have trouble speaking or slurred speech? T is for time. If any one of these signs is present, it's time to call 911. You also should note the time that symptoms first started. This is important information to provide EMS, as some treatments are only effective within a certain time after the onset of a stroke. Stroke can be hard to recognize in a child. If the child has neurological symptoms such as confusion, trouble speaking, or weakness in their limbs, it could be a stroke, and you should immediately call 911. While waiting for EMS to arrive, stay with the person and offer reassurance. Follow the general care guidelines and give additional care if needed. 911. You also should note the time that symptoms first started. This is important information to provide EMS, as some treatments are only effective within a certain time after the onset of a stroke. Stroke can be hard to recognize in a child. If the child has neurological symptoms such as confusion, trouble speaking, or weakness in their limbs, it could be a stroke, and you should immediately call 911. While waiting for EMS to arrive, stay with the person and offer reassurance. Follow the general care guidelines and give additional care if needed.
Volume and flow are two ways to tell if bleeding is life-threatening. Volume is the amount of blood present. Think about a soda can. Bleeding may be life-threatening when the amount of blood present is equal to about half of what a soda can contains. In a small child or an infant, bleeding may be life-threatening when the amount of blood loss is even less. Flow is the movement of blood. Blood that is flowing continuously or spurting is also a sign of life-threatening bleeding.
It takes a lot of direct pressure to control life-threatening bleeding. You need to push hard and for a long time. Ensuring there is a firm, flat surface underneath the injured body part makes using direct pressure more effective. This may be painful for the injured person, so let them know it will hurt, but it is necessary. To apply direct pressure, put on gloves if you have them, and find the source of the bleeding. If the person has more than one wound, focus on the life-threatening bleeding first. Then, place a dressing on the wound. The best choice for controlling life-threatening bleeding is a hemostatic dressing. This contains a substance that promotes clotting and can help stop bleeding faster. Use one if you have it. Otherwise, a regular gauze pad or any clean material, such as a t-shirt, may also be used as a dressing. When applying pressure, use both hands and position your body so your shoulders are directly over your hands, with your elbows locked. You might recognize this position from learning CPR. Use your body weight to apply firm, steady pressure. If blood soaks through the dressing, place a second dressing on top of it and continue direct pressure. If the second dressing also becomes soaked, you may remove it and replace it with a new one, but do not remove the original dressing. This could disrupt a clot that is forming and make the bleeding worse. Keep applying direct pressure until the bleeding stops, a tourniquet is applied for life-threatening bleeding from an arm or leg, another responder relieves you, you're too exhausted to continue, or the situation becomes unsafe. If the bleeding stops before EMS arrives, apply a roller bandage over the dressing to hold it in place. Place the end of the bandage on the dressing at an angle. Then, wrap the bandage until the dressing is completely covered, including a margin of several inches on the sides. Tape, tuck, or tie the bandage to secure it. It should be snug, but not too tight. If the person complains of numbness or tingling after the bandage is applied, it may be too tight. Carefully loosen it. Finally, always wash your hands after giving care for a bleeding wound, even if you were wearing gloves. Take this important step after EMS or another responder takes over care.
Here's a brief look at how to apply one type of windlass rod tourniquet. Place the tourniquet 2 to 3 inches above the wound. Pull the strap as tight as possible. Twist the rod until the bleeding stops or until you can't twist it anymore. Then, clip the rod in place. Always follow manufacturer guidelines for the tourniquet you have, which may use a hook and loop fastener instead of a buckle as shown. There are also ratcheting tourniquets that tighten by lifting and lowering a buckle.
A burn is a traumatic injury to the skin and sometimes underlying tissues caused by heat, chemicals, radiation, or electricity. Burns can look different. They might be red, brown, black, or white, and you'll often see swelling, blisters, or both. While even a small burn can really hurt, some burns might not hurt at all if the nerves are damaged. Many burns can be treated with first aid care alone, but if a burn falls into one of these categories, call 911 and get equipment as needed.
Yes.
Call for a burn that affects deeper layers of skin or the fat, muscle, or bone underneath, covers more than one body part or a large percentage of the body, goes all the way around a body part, such as a limb, the chest, or the neck, could impair a person's ability to function or breathe, or it was caused by inhaling hot gas or by electricity, chemicals, radiation, or an explosion. You should also call if the person has other medical conditions or injuries, or if they are an infant, young child, or an older adult. Care should focus on cooling the burn. To do this, place the burned area under clean, cool running water for 5 to 20 minutes. If there is not clean running water available, use a cool or cold compress, but never use ice or an ice pack because doing so could cause more damage. When cooling a burn that covers a large area of the body, stay alert for signs of hypothermia. This is especially true if the person is a child. Leave the burn uncovered so EMS personnel can give additional care when they arrive.
Unfortunately, accidents like this are more common than you might think and can lead to serious head, neck, or spinal injuries. Since these injuries can involve the brain or spinal cord, it's important to take extra care when helping someone in this situation. Signs and symptoms of a head, neck, or spinal injury may include pain or pressure in the head, neck, or back, or a visible injury, partial or complete loss of sensation or movement in part of the body, seizures, nausea or vomiting, impaired breathing or vision, inconsolable crying, or a change in behavior or mental status. Always assume an injury involving the head, neck, or spine could be life-threatening. Call 911 and get any equipment you may need for care immediately. While waiting for EMS to arrive, have the person stay in the position in which they were found, unless you must move them to give CPR or control bleeding. Follow general care guidelines to help them stay comfortable, including helping them maintain their body temperature, and care for any other injuries they have based on your training. Next, let's talk about concussions. They're a specific type of head injury that's worth calling out. While they're often linked to sports, a concussion can happen anytime someone takes a bump, blow, or jolt to the head. This sudden impact can cause the brain to move rapidly within the head. Even a hit that seems minor can lead to a concussion. Signs and symptoms of a concussion are similar to other head, neck, or spinal injuries, although they sometimes will not appear until hours or days later. If you think a person may have a concussion, advise them to stop what they are doing. Then call 911, get equipment as needed, and give care as previously described. If for any reason EMS is not called, the person should follow up with a healthcare professional as soon as possible for a full evaluation.
Life-threatening heat and cold-related illnesses include exertional hyperthermia, heat stroke, and hypothermia. While extreme temperatures are a risk factor, these illnesses can also happen at more moderate temperatures if certain conditions occur. Exertional hyperthermia and heat stroke happen when the body's cooling system becomes overwhelmed and stops working. While a person with a heat-related illness may sweat a lot, they may also stop sweating altogether. Other signs and symptoms include moist, pale, or flushed skin, confusion or dizziness, seizure, headache, nausea or vomiting, weakness, rapid shallow breathing, or a rapid or weak heartbeat. Eventually, they may become unresponsive. Always call 911 and get equipment if you think a person has exertional hyperthermia or heat stroke. Then take steps to rapidly cool the person. If you can safely do so, immerse them up to their neck in cold water for 15 minutes. If this is not possible, use another cooling method, such as ice packs or a cooling vest. Misting the person with water while fanning them can also work. Hypothermia happens when a person's body loses heat faster than it can produce it. Besides cold weather, prolonged exposure to wetness is often a factor. In the early stages of hypothermia, a person may be shivering and have cold, pale skin. But as their condition gets worse, shivering may stop. That's a warning they need immediate help. You might also notice the person acting confused, indifferent, or staring blankly. In advanced cases, they may become stiff and unresponsive with breathing that slows or stops. A person with hypothermia needs life-saving care. Call 911 right away and get equipment. Then, slowly warm the person up. Move them to a warmer place, get them in dry clothing, wrap them in blankets or plastic sheeting, and cover their head. If they can swallow, you can offer sips of a warm drink. Do not try to warm the person up quickly by immersing them in hot water. This can lead to a dangerous heart rhythm. A poison is any substance that causes injury, illness, or death when it enters the body, whether it's ingested, inhaled, absorbed, or injected. This includes substances that are intended for internal use, but are taken by the wrong person or in the wrong amount. Signs and symptoms of poison exposure can vary widely from skin rashes to stomach pain, trouble breathing, and more, depending on the poison type, amount, and the way it enters the body. Your check of the scene and the person will often reveal clues that poisoning and not a different sudden illness has occurred. For example, you might notice an open or spilled container, an unusual odor, burns or residue around a person's mouth, or multiple people at the scene who are also ill. As always, if the person has signs and symptoms of a life-threatening condition, or if multiple people are affected, you should call 911 and get equipment immediately. If the person is responsive and alert, you can instead call the National Poison Helpline at 1-800-222-1222. They will advise you on the best care to give.
Elena and Ivy are in the office lounge discussing their morning meeting when Elena notices their colleague, Rocco, seated across the room. His face is twisted in pain, and he's clutching his chest. Alarmed, Elena immediately senses something is wrong. Suddenly, Rocco collapses to the ground. His eyes are closed. His body still, he appears unresponsive. Before calling or giving care, Elena should check the scene for safety and check Rocco for responsiveness and breathing. Elena should do the shout tap sequence. Elena checks the scene for safety. Then she checks Rocco for responsiveness using the shout tap sequence and checks for breathing. She looks to see if Rocco's chest is rising and falling and listens for normal breathing that is quiet, regular, and effortless. If Rocco does not respond in any way, the irregular gasping or snoring noises that Rocco is making are called agonal breaths. These types of sounds are just a reflex as opposed. If a person is in cardiac arrest, Elena's shoulders should remain directly. After opening Rocco's airway to a past neutral position, Elena should give 2 breaths. Each breath should last about 1 second and make the chest begin to rise. After delivering the shock, Elena resumes CPR and Ivy meets EMS at the front door. When EMS arrives, Daniel is at the library with his children, Mia and Ben. Brittany, the children's librarian, is picking out a book for story time when Daniel cries out, "Mia! There's something wrong with her." Mrs. Perez, Victoria, and Lucy are talking during snack time. Victoria takes a big bite of her apple slice, then suddenly grasps Mrs. Perez places the thumb side of her fist against Victoria's abdomen. When Victoria becomes unresponsive, Mrs. Perez should carefully lower her to a firm, flat surface and immediately begin CPR with chest compressions. The chest compressions used in CPR may dislodge the object. In addition, she should use an AED if one is available. After each set of chest compressions and before attempting breaths, Mrs. Perez should open Victoria's mouth and look for the object. If she sees an object in Victoria's mouth, she should remove it with a finger sweep. Natalie is working a shift at Java Smuggler's Cafe. Mark is experiencing a life-threatening emergency, and Natalie must act quickly to get help on the way. To assist Mark, Natalie should first verify that she has the correct medication and prepare the epinephrine autoinjector. She should then hold his leg still and encourage him to use the device as A sudden crash echoes through the wood shop, followed by Avery's sharp cry of pain. She accidentally cut her